Good afternoon, everybody. Welcome to our first webinar of 2021 with Alberta SCILS. We're just going to give a few more people to log in and we'll get started. So welcome, everybody. Thank you for joining us today. My name is Zara. I'm with Spinal Alberta. I'll be your facilitator for today. Our topic today is on mental health, depression, and coping skills. We have Simren Jhuty, a registered psychologist, and Snanna Virk, who is a certified mental health coach from SCI Psychology, who will be presenting, as well as Margaret Conquest, who is one of our peers. Just a reminder, the Alberta Rehabilitation Advice Line is available 7 days a week from 10 a.m. to 6 p.m. And short disclaimer, the information contained in these webinars and related materials is not a substitute for professional medical advice, diagnosis, or treatment. Please contact your medical practitioners for more information and to see what is right for you. This webinar is being recorded and will be made publicly accessible. And a few housekeeping rules. Everybody will be muted. There will be a short presentation followed by breakout rooms and a group discussion, and everyone is invited to share. Just a reminder that during the discussion period, we will be turning off the recording. If you want to participate in the conversation, you can either request to speak or type your questions in the chat box or wave your hand. And we will be monitoring the chat box throughout the presentation. And also, we are currently conducting an evaluation to ensure we are providing an effective tool that helps create a sense of community, change perceptions on disability, and improve social connectedness. So you will see a link in the chat box throughout the presentation for you to complete the evaluation. You will now see 2 polls show up on your screen. Please take 30 seconds to complete them. Thank you, everyone, for completing the polls. So we will get started with our presentation. I'd like to introduce Simren Jhuty, registered psychologist with SCI Psychology. Take it away.
Thank you for the introduction, Zara, and thank you to those of you who are attending the webinar today. Before we begin discussing today's topic, depression and coping skills, I'd like to give some background information about SCI Psychology and who we are. Next slide. So about SCI Psychology, our mission is to help individuals identify the root causes of their concerns and provide them with evidence-based tools that will help them cultivate a path towards a successful future. Next slide. SCI Psychology offers psychological testing and evaluation for children, adolescents, and adults to assess their intellectual, emotional, and social functioning, as well as their academic achievement. We also offer online and in-person individual and group counseling services for individuals of all ages to help them manage their emotions and behaviors and provide them with tools and coping skills to help improve their overall well-being. Next slide. A little bit about myself. I'm a registered psychologist in Calgary, and I'm the clinical director of Stride Psychology. I have a Master's of Science in Applied Pediatric Neuropsychology. I have worked in private research, hospital, and educational settings, and have had the opportunity to work with individuals who come from diverse families, cultural, and backgrounds. While I am a diagnostician at heart and passionate about conducting psychological assessments, I'm also passionate about helping and supporting individuals with any mental health related concerns. Next slide. Snanna Virk is a certified professional coach specializing in mental health. She is the founder of Kids Lead, a social skills program catered for children and adolescents. Snanna works collaboratively with individuals of all ages, specifically those who experience difficulty with regulating and managing their emotions, attention, and impulsivity. She also works closely with individuals who engage in self-harming behaviors. Snanna is trained in various therapeutic modalities, including cognitive behavioral therapy, dialectical behavioral therapy, and ADHD coaching. Next slide. So let's begin talking about what is depression. So depression is a mental illness characterized by persistent low mood and a decreased ability to engage with the world around you. Depression is the #1 disorder of modern life and is on the rise in all age groups. According to the World Health Organization, 300 million people are affected by depression at any one given time. Depression is the leading cause of disability worldwide and is a major contributor to the overall global burden of disease. Next slide. So symptoms of depression can manifest very differently and in 4 different ways: mentally, physically, emotionally, and behaviorally. Some of these examples include concentration difficulties, negative intrusive thoughts, sleep disturbances, appetite changes, social withdrawal, becoming unhinged from your routine, so having difficulty being able to brush your teeth, for example, numbness, guilt, and shame. Next slide. So here are some things that you may not know are symptoms of depression. Let's discuss a few. Memory challenges. So for example, remembering key instances in the past or day-to-day things, such as a work deadline or a friend's birthday. Slowed movement. This may be because your body is so fatigued and drained of energy. Feeling disoriented, because the depression fog may distort your day-to-day living. Getting stuck on certain thoughts. This may be ruminating about a past mistake or a present struggle. Next slide. So what are some common struggles that individuals face with depression? Let's discuss a few here. Number 4, struggling to get out of bed. This can be extremely difficult since physical fatigue is a symptom of depression. Also, staying in bed can be a survival strategy on the darkest days. Neglecting chores, such as doing the laundry, number 5. A big part of depression is also concentration difficulties. So breaking down things into small tasks can be difficult due to the depression fog that clouds our consciousness. Number 10, connecting with others. People with depression may socially withdraw. Sometimes safety needs to be prioritized, and often those with depression don't want to bring the mood down, so they withdraw to protect others. Next slide. Let's talk about what depression is not. Depression is not sadness. Sadness is a temporary, healthy emotion that is a response to a direct cause, such as having an argument with somebody. Depression, however, is a complex mental illness that can last for years. The intensity of symptoms fluctuate, but its presence can be constant, felt even on one's good days. Depression is not grief. Grief is a more intense sadness that is felt in response to a very painful event, such as the passing of a loved one. Intense grief and loss can lead to depression, but still differs from depression in complexity, experience, and impact on day-to-day living. Depression is not an excuse. The symptoms of depression can cause significant disruption in day-to-day living. Depression is not something one chooses to get. No one would choose to live with a debilitating illness that causes such intense suffering. And depression is not something you can snap out of. If it was that easy, there wouldn't be 300 million people in the world living with depression. Next slide. Depression does not have a universal appearance. Some like to talk a lot to work through their problems. Others want to socially withdraw and not talk at all. Some have intense bouts of suffering. Others feel it constantly at a lesser intensity. Depression can be invisible. It's making jokes so others feel the joy you are unable to. It's texting "I'm fine" when your eyes are full of tears. And it's giving motivational speeches to others when you feel totally lost in the world. With that being said, it is important to recognize that high-functioning depression exists. People with depression can fulfill their obligations, but collapse from exhaustion once they're done. They can be battling negative, intrusive thoughts while also supporting a loved one. They can do what is essential to a high standard, but neglect other things. Their good days are like people's average days. Next slide. People with depression hold very strong beliefs, emotionally driven beliefs as to how bad things are, how bad people treat them, and how the future is hopeless for them, and so forth. There are 3 ways of thinking that are common for people suffering from depression, which include the first one. People with depression tend to globalize negativity. The bad event is specific, but to someone who is depressed, everything is ruined. They take one bad thing and spread it to cover the whole of their reality. For example, I failed my math test, my whole life is crap. My relationship ended, nothing ever goes right. One situational event is extrapolated to cover all situations. This thinking style is driven by feeling hopeless. The next thinking pattern is internalizing negativity. The cause of the bad event is assumed to be entirely due to the individual's core identity. Possible external causes for the negative event are minimized or entirely unperceived. For example, my marriage ended, I screwed it all up. Why does this always happen to me? It's something about the badness of me that causes bad things to happen. This is just my luck. It is also very common for people with depression to overly externalize the causes of their misfortune. For example, it is their partner's fault, it is society's fault. The third thinking pattern is stabilizing negatives. Bad things are seen as permanent or stable. For example, nothing has ever worked out for me, I'll never get better. Bad things are seen as permanent, and positive things are seen as temporary and fragile. They're too good to last. For example, my relationship is good at the moment, but it will not last. Again, these are emotionally driven, classical depressive thinking styles that can be quite entrenched with people experiencing depression. Next slide. What do negative thoughts sound like? Here are some examples of negative intrusive thoughts. I'm such a burden. What am I good for? I don't have the energy to get out of bed. I'm so worthless. No one understands me. Things will always be like this. I'm such a terrible person. Everyone would be better off without me. No one really loves me. How could they? Next slide. What is cognitive behavioral therapy? So, cognitive behavioral therapy is a therapeutic modality that aims to improve mental health. CBT focuses on challenging and changing unhelpful cognitive distortions and behaviors, improving emotional regulation and the development of personal coping strategies that target solving current problems. CBT has long been seen as a useful tool in helping lift depression. However, the most powerful antidepressant of all is knowing how to generate hope in an individual with depression. When feelings are powerful, as they are in depression, we as mental health professionals need to work to calm these feelings first and foremost. But once the mind is sufficiently calm, then we have a chance to help the individual widen their context by seeing reality above and beyond the usual depressive thinking biases, some of which were mentioned previously. Then we can help the individual get into the habit of generating non-depressive causes for life events and get them thinking differently. CBT techniques work as reframes. Reframes are not just cognitive. Reframing happens as an experience in the individual's mind. It's not a matter of logical deduction or reasoning. The individual needs to feel and think the new ways of thinking is more true than the old depressing view. Trying to change thoughts while strong emotions still dictate those thoughts may not work. As mental health professionals, we may need to change their emotional state before widening their cognitive context for a reframe. So what is a CBT technique that is used to help treat depression? Simply asking questions can help people rediscover new ways of seeing themselves. Clinicians use a technique called reflective reframing. Again, people with depression hold very strong beliefs, so we want to use a non-depressive explanatory style. This is called cognitive reframing. Here's an example of what a client with depression may say. My whole life is just a total mess. This is negatively global, which is the first negative thinking pattern we discussed earlier. We can reframe their way of thinking by saying, so you haven't yet got the things you needed back from life. This question is non-stable and specific. It is time limiting their misery and implying that it is more specific. Here is another example of what a client might say. Nothing ever works out for me. I may screw everything up. That statement is global, stable, and internal. We would then ask, what are the specific things that haven't worked out for you in the past? What are the specific things that have been mistakes in your view? These questions are specific and non-global. We are taking out the depressive explanatory style out of the feedback that we are providing them with. We don't want to reframe depressive thoughts in a way that isn't forced or obvious. We don't want to argue with our clients about their perspectives. Instead, we want to work more directly with understanding about how depressive thinking has been blighting them. We want to describe the pattern of the depressive thought, and we want to help the client see their pattern of depressive thought bias from the outside and help them generate a more flexible thought process. Snanna will now be discussing coping skills for depression. She'll be identifying what self-care looks like for individuals with depression and discussing particular strategies and techniques that are helpful in reducing symptoms of depression.
Thanks, Simren. Next slide. So what does self-care look like while experiencing depression? Some examples include stretching your body. This will help prevent aches and pains from lying down, sitting down for long periods of time. Setting alarms for the little things, whether this is to drink a glass of water or brush your teeth, this will help add some structure to your darkest days. Doing a small task to establish order, whether it's picking up clothes off the ground or washing a few dishes, this will help you feel more in control and prevent the downward spiral of negative thinking. Aromatherapy. Put on some essential oils or candles. This will help stimulate your senses and bring you some awareness to your surroundings and away from your thoughts. Breathing techniques. So breathing is very powerful and helpful in alleviating symptoms of depression. Breathing helps you to stay grounded in the present moment and calms your nervous system. I'm going to be doing a breathing exercise. Actually, I'm going to do two breathing exercises with you. So the first one is 5-finger breathing. You can take your hand, stretch out one hand so that you have space between your fingers. Hold up your pointer finger from the opposite hand, and you can start at the bottom of your thumb. So start at the bottom of your thumb. Use your pointer finger to trace your thumb as you slowly breathe in through your nose. And then when you get to the top of your thumb, slowly breathe out of your mouth as you trace down the other side. And you can repeat for all fingers. So breathe in and out, and breathe in and out. Breathe in and out, and breathe in and out. And so you can repeat for all fingers until you've traced your whole hand, and you can continue to do that until you feel some feelings of calm. The next technique is called breathing for calming and relaxing yourself. And for this, you can breathe in for a count of 4 through your nose. We can actually do that all together. So if you breathe in as I count to 4, so breathe in through your nose. 1, 2, 3, 4. Now we can hold for a count of 4. 1, 2, 3, 4. And now you can exhale for a count of 4 through your mouth. So 1, 2, 3, 4. You can actually do this for a total of 10 breaths or more, depending on when you get to that feeling of calm. Next slide. So affirmations. Affirmations to help you get through a depressive episode. Affirmations are another way to help alleviate symptoms of depression. So affirmations can be very helpful for combating self-defeating thoughts. And here are some affirmations. I am resilient. I will get through this. My discomfort won't last forever. I am much more than my opinions of myself. I'm unshakable in tough times. I have 100% track record getting through the dark times. I am stronger than this. I am valued even when I'm not productive. I am loved despite my sadness. I'm appreciated even when I can't contribute much. I am needed even though I feel worthless. I am separate from my depression. I am not any less of a person because certain people can't understand my illness. Next slide. So how to support a loved one during the pandemic? Reaching out to them. This isn't just texting, how are you? But opening the door to any form of interaction, whether that's reminding them of a nice memory you recently recalled, or asking if they saw something on TV that you know that they'd be interested in. If appropriate, connect and stay in touch with a close friend or a loved one around them. This will help give them more insight, this will help give more insight into how they're doing and allow for extra insights you may not be able to get otherwise. Make time for deeper conversation. So texting is great, but setting aside some hours where they're able to talk freely without pressure, expectation, or judgment can do wonders. Experience togetherness, but from afar. This may be having a watch party online, watching your favorite TV show, playing an online game together, or having a virtual dinner together. Gently encouraging therapy. This isn't just telling them to see a therapist, but offering to research a good one in their area, offering to help them financially, scheduling the appointment if they agree, and making yourself available before and after the session to help them debrief and work through any distress. Next slide. And now I will turn this over to our next presenter.
Thank you, Simren and Snanna, for the presentation. I would now like to pass it over to Margaret Conquest, our peer, to share her story.
Thank you, Zara, and thank you to both Simren and Snanna. So many people on this webinar, I can see know me already, but there's lots that don't because I don't know you. So very quickly, I have been injured for 30 years. I have a high spinal cord injury. I'm a quadriplegic. I'm incomplete. I'm 46, and there's no shame in admitting my age. So what I'll be talking about is just my experience of being injured for 30 years, of being alive for 46 years, and supporting not only my own mental health, but others around me, both professionally and personally. And I haven't been diagnosed before as having depression, so to speak, but have had lots and lots of ups and downs and difficult times throughout my life and in my relationships. So a lot of, when I reflected upon how would I share my experience in this webinar, a lot of it revolves around the way I see myself, my identity at the time of my injury and throughout the lifespan, who I wanted to be versus who I was actually in the moment, or whether or not who I thought I would be, I could continue to be, and what value I placed on that, and what value did others assign to the role I played, or the image that I had in my mind of who I should be. And it's things like when I was injured at the age of 16, I thought for sure I was going to get married. I was going to have all the babies God was going to bless me with, and that was very much thrown up in the air, and I wasn't going to be that anymore. And then I went on to university and I met somebody, and everything was amazing, and we married, and I thought I was going to have kids, and then we didn't have kids. And so that was another sort of self-image change, or the story I told myself about who I was going to be was changing. And then through that process, my partner, my husband, and I had some very difficult decades, I'm not going to say years, where the enchantment of being in a new relationship changed drastically. And that was very, very sad to see that enchantment change, and also very, very challenging to go through those periods of time. And then all through all of that, a whole bunch of other things around my physical health, which we'll get into in a few minutes, and identity I had tied myself to. It became very difficult to cope and be happy when who I wasn't who I wanted to be anymore. Next slide. So with the ups and downs of having a spinal cord injury and just the physical health, no one asked me if I wanted this. It's a very big thing to cope and not even just be successful, just get through your day-to-day life with a spinal cord injury, and it can be really overwhelming. And as time goes on with a spinal injury, you don't just go onward and upward. Things go up and down, and there's chronicity with either neuropathic pain or fatigue associated with getting through your day, weakness, and those things, especially those things, color the way that I see my day-to-day, my happiness. And in addition to having a spinal cord injury, I have IBS, and I have had a myriad of all these other things that complicate having a spinal cord injury, and having a spinal cord injury complicates them. And so sometimes it just is so overwhelming. It's difficult for me to see past the moment that I'm in. And so again, when I was looking at what have I done, what has been successful for me, or what have I done that hasn't been successful for me? Next slide, pardon me. What have I done, and what's percolated up as something I should mention in our webinar today? And a big part of this is reaching out. When I was first injured, I didn't want to be a part of the community of people with spinal cord injury, and to a detriment to myself, I didn't reach out in the beginning. And moving to Edmonton from our small town, I started university, and I started connecting with people with spinal cord injuries and other disabilities through what's now called the Stedward Centre. At that time, it was the Rick Hansen Centre. And then through my practical work at the Glenrose Hospital, I started to reach out and speak to other people with spinal cord injuries. And all of a sudden, this huge world opened up where I could talk to other people who understood, and not just people with spinal injury, but the more I spoke about my own experience, the more I realized it was somewhat universal. And that has been therapeutic, and generally just allowed me to be a more successful human being. Terminal curiosity, I think, is invaluable. And when I say terminal curiosity, that is always being curious about the world around you, about the people around you, and remaining open to reinventing yourself, finding things in your life that spark joy for you. It has been something that I've found to be hugely life affirming, brings some energy back into my life, turns the clock back a little bit. And yeah, naming your feelings. I know that sounds a little silly, and there are easy emotions to name: angry, sad, happy. But sometimes it isn't particularly enlightening or useful to just name those. And I think sometimes getting a little bit more detailed, and if you can't come up with those what you're feeling or what you're going through, there are great generators online that you can go through a big long list. I feel like nobody likes me. I feel like you don't like me. I don't feel like anyone hears me. I feel ugly. I feel useless. Like things like that that allow you to then dive a little deeper into what it is that's flavoring your experience of life. Allowing some time for negative emotions and for worry. And it's something a phrase I took out of a book I read called swamping. Like you sort of walk around in your shitty state of mind for a little bit, and you name that this is unfair. I am tired being tired. I'm tired of being in pain. And if there's other people who maybe share this experience with you, you can do it with them. And that's great. And then flipping to the next bullet, get some space from that. Divert your attention, seek pleasure, remind yourself of the good things that you do have in your life. Pleasure seeking, something that people who know me know that I am a huge fan and proponent of pleasure seeking. And I don't mean just in an intimate or a kinky or a sexy way. I mean pleasure in all its forms, and pleasure, pursuit of pleasure for no other reason. I think many people feel like it's frivolous, like there's too many other things that they have to do. And I think that this is a huge disservice to do to yourself, to not feel absolutely justified in seeking pleasure sometimes before you do any of the other things that you have to do. When you're really heavy and when things are really difficult for me, just saying yes to things is sometimes a huge, it breaks the momentum of the sadness or the heaviness. There's only two things you ever need to do: start and finish. So just show up to something, even if you aren't going to participate in it really actively, just to be a part of what's going on around you sometimes can also change your perspective, and changes my perspective. And then just to be kind to yourself, do your best every day, and to know that your best will look different every day. So getting up and having a coffee, maybe that's your best today. And there are days when that is the best I can do. And so not being too hard on yourself, and setting small winnable goals, and knowing those goals are going to look different every day, and knowing your day is going to look different, and your best every day is going to be different, I think is important. And there's probably a million other things that I could talk about around my experience of pursuit of a worthwhile day-to-day experience, but I would rather that we move from this point on to some sharing, some question asking, and go from there. So thank you.
Thank you so much, Margaret. Really appreciate that. So we are going to take some time to discuss. We're going to do things a little bit differently today. As mentioned at the beginning of the webinar, we're going to try breakout rooms this time around. And so screen is going to look exactly the same, except we're going to be split into two different groups. And this is your opportunity to ask questions to the presenters or to Margaret. And we'll just wait for Joanna to do that. So if you look on the bottom, of your toolbar, there should be an icon there that says breakout rooms. So if you click on that, you should be able to go into your designated breakout room.
So there are 2 breakout rooms with Simren and Alicia and Snanna and Zara, and all the participants can choose which breakout rooms they want to go to, and I believe Margaret will be available to jump into each breakout room.
Thanks everybody, and we'll see you in a few minutes. Please complete it if you can.
Just a quick question. To access Stride services, can it be through self-referral, just reaching out to you guys or anything like that?
Absolutely. Yeah,
Okay.
you don't need to necessarily get a physician referral in order to contact us. You can contact us directly.
Perfect, thank you.
Mm-hmm.
Also, I just want to mention, I would love to have a conversation about anxiety. I don't know if anybody else would be interested, but just to put it out there.
Clinically diagnosed, so I'm down.
Me
Well,
too.
that makes 2 of us.
100% anxiety.
Yeah, that's my area.
Presentation today. Once again, Simren, Snanna, Margaret, thank you so much for presenting today and being open to discussing. You can find us on our social media platforms, Spinal Cord Injury Alberta, SCI, or on Facebook, Instagram, and Twitter. And this will be posted on YouTube as well for future, if you wanted to watch it again. And if you want additional information, the email address at the below is Steve. So you can contact him for more information. Thank you again for everybody sharing their stories. Really appreciate it. And we will see you in a few weeks.
Thank you.
Bye.
Bye.